There have been reports that coming out recently that during the pandemic, and especially these past couple of months, that kids are coming in, adults are coming in with cracked teeth. Reports of people grinding their teeth more than usual. So I wanted to kind of get a sense as far as, is this taking place? What people can do preventatively to take care of their teeth? We have Dr. AJ Acierno, founder and CEO of DecisonOne Dental, here to join me. First of all, thank you for joining me today. And are you seeing a lot more people coming in with grinding teeth issues?
Yeah, there's absolutely no question. The last 2 years has been quite the stress on everybody. And unfortunately, our teeth are one of those things that takes the beating from it.
So you have, maybe a test the next day, or you have a job interview, or you have a stressful situation. How long does it take for, that might be one night of grinding your teeth. How long does it take for damage to actually occur in your teeth?
The best thing I tell my patients is that stand in front of the mirror and grind your teeth for 30 seconds, right? And some people think I'm going to grind all night long. You're really only probably grinding a half hour. But if you stand in front of the mirror for, you sleep 8 hours, if you stand in front of a mirror and you do grinding for 30 seconds, it's a lot. So if you compound that for a half hour, it's a lot of grinding that occurs during the night. But if you're in a stressful situation and you're going through, some type of, whatever we're going through now in the 2 years that we're dealing with this, if it's just a one-off or maybe a week long, 2 weeks, then you're usually okay. But we very rarely ever see that. If somebody's a grinder, they are a grinder, right? And we see the effects of that over time very quickly. I mean, we could see a 25-year-old patient that has all their permanent dentition only for, a 10-year period, 13-year period. And there's quite a bit of grinding and quite a bit of wear.
You're carrying this on for, years at a time. How much damage are you seeing, people come in with?
So usually what happens is that those that are very proactive on it are getting TMJ or muscle jaw joint discomfort, right? Some of our younger kids get jaw joint discomfort, and that's what creates them to say, hey, something's going on. Where adults usually come in is when it's too late. Adults see grinding and the effects of grinding when any of their front or anterior teeth become chipped. That's when they're, oh my, I got to do something. I must have chipped my tooth. At that point in time, you are well behind the 8 ball of fixing it, because you can fix a chip, but all the wear has occurred already. And so usually it's a more expensive project. Usually it's, okay, I just can't fix it with some composite or some filling material. And now you have to go into something greater. So you really want to take into account when you wake up in the morning and you feel tightness in your jaws, you feel tightness in your muscles, and you feel like, man, I must have done something last night, my jaw, something. That's when you need to go see the dentist. Do not wait until teeth are chipped, pain occurs. Those are the times not to come in. I mean, do come in, but try to come in before that. Of course.
Try to come in before it's too late. Now, a lot of people, obviously at night might have their phones next to them and it's like, let me scroll through social media. Let me see what's going on in the news. And that could create stress. A lot of people might, relax with a glass or two of wine, before heading off to bed. Are these all stressors that are adding to grinding teeth at night? Or is there anything that you suggest as far as like what people should do to try to maybe minimize their effect of grinding?
Been in business since 2001. So I got 20 years under my belt. And in the last 2 years, I have never seen so many effects of grinding ever. You always get broken teeth because of silver fillings. Silver fillings expand and contract. They create cracks and they crack. I mean, the chips, the TMJ issues, the cracked teeth, are immense. There are, we're putting one of the recommendations that we're seeing a lot is putting patients into night guards, right? Being able to put a patient into a guard that can protect them during the night. A lot of people say, I catch myself during the day clenching my teeth. During the day, consciously, you catch yourself and you stop. At night, when you're in a deep sleep, you do not catch yourself. So that's what exaggerates the symptoms and the seriousness of it, because as you're sleeping, you just continue grinding. You don't catch yourself, and that's what creates the problem. Hence why a night guard is one of the better recommendations.
Let's talk a little bit about parents, because obviously as an adult, you know that like my jaw hurts, I chipped a tooth, I'm having these, I'm obviously feeling stressed every day, at night and in the mornings. But as a kid, maybe how young are you getting patients, and what's something that parents could maybe ask their kids to see if this is a stressor or something, if they might need a night guard, and what ages you might recommend for that.
This is no joke. I promise you this. Okay. This morning, I had to check one of my daughter who's 12 because her jaw was hurting. I don't think it's any, I think there's a lot of, she has a big test Friday in the Constitution. So I don't think this is any, so I have seen 7 years old, during what we call a mixed dentition. When the adult teeth are growing in and you have baby teeth and adult teeth, grinding is not abnormal during that position. Now, because of the mixed dentition, putting a child into a night guard is not common. Putting a child into a night guard would be very difficult for them to wear it. So understanding as that you don't worry about that so much. You want to see your dentist, you want to make sure that everything's okay, but it is normal to see your children that are going through mixed dentition grinding their teeth. Once they have their teeth in place and the grinding turns into stress, or where their muscles are starting to become affected by it, they'll say, oh man, it hurts right here it hurts. Once they say that, then you know that there's some grinding issues that are coming about. And there are many other types of ways that you can take care of a patient besides a night guard that can help your children.
Now, let's just talk a little bit about those. What are some preventative measures that adults and kids can take away? I know we were trying to talk as far as maybe putting away the phones, or not, trying to cram, doing those late night study. I'm guilty about that as well too. In college, of like studying until 2 a.m. to take that 8 a.m. test. These are all like, stresses that are adding upon everything else that we're going on. What are some things that people can do to try to minimize those effects of grinding?
So as a child, right, we have seen the effects of social media and the effects of phones increase grinding during that. So I would be, from electronics prior to bedtime is one of those things that we've seen. So we want to put that off to the side, right? It is not as simple. This is a psychological issue, right? Neurobrain muscular activity on our jaws, right? So it's not as simplistic as, oh my gosh, just tell yourself to stop. A lot of people say that, like, I'm just going to tell myself to stop. I've yet to meet anybody that was able to do that, right? You can help yourself relax and help yourself get better sleep. Now that will help for sure. Night guards are the primary source. I will tell everybody that if you have jaw joint discomfort, do not buy an over-the-counter night guard. The ones that look like a football guard. They're very soft. And soft, if for us that have played football or any other sports where you wear a custom guard, what do you see the players always doing? They're always chewing on it. Right. So when you have something soft in your mouth, sometimes it'll cause more clenching or more grinding because of the softness to it. So some people say, well, I got this over the counter night guard and actually my jaw hurts worse. Well, yes, because you were clenching all night. You might have stopped grinding, but now you're clenching, and those are two different things. We have clenchers and we have grinders. So really getting to the dentist and figuring out what is the best course of action. Some people, it's just a minor, hey, you're going through this hiccup in life. Let's try a little ibuprofen, do these things to help with your sleep and so on and so forth. And let's see if this gets better. Some people where we've actually seen wear facets and problems or cracked teeth, then we move them into that night guard situation where it's soft on the inside, hard on the outside, and very good. Now, I will say one of the biggest things that we've seen, okay, so this now deals with the whole effect of your body. When you're clenching and grinding, we have seen a lot of sleep apnea. Okay, so being able to go to the dentist and a dentist to be able to say, do you snore? Let me check your tonsils. Let me see your airway. All those things are massively important into grinding, because when you have sleep apnea, or let's say when you're doing CPR, you take your chin and you move it forward, right?
Yeah.
It opens up the airway. We naturally, when we start to have sleep apnea and our oxygen starts to deplete in our body, we grind our jaw forward in order to open up the airway naturally, right? And through snoring and other things, those are all signs and symptoms of sleep apnea. So I would tell anybody, If you're also a grinder, the reason you want to get checked out is you want to make sure that you're not going through effects of sleep apnea, which are extremely dangerous in your body, which can be fixed with CPAP or can be fixed with an appliance that moves your jaw forward and opens up your airway at night to help you breathe.
So it could be the sleep apnea that's causing the grinding. Does the grinding ever cause the sleep apnea?
Usually it's sleep apnea causing the grinding, right? And that's usually the case on there.
That's usually the case. And the case with anything, you don't want to try to self-diagnose yourself. Go to your dentist and go ahead and make sure that you're getting that proper night guard. You're getting treated regularly. And of course, go for your regular appointments as well too.
Yeah, usually your mate will tell you whether they'll be the first to diagnose. Like, I can't sleep with you because you're noisy. Okay, that's number one.
If you're getting pushed at night or pillows being hit at you during the night, there's probably an issue.
That's right. And then if you stick your tongue out and you have ridges on the side of your tongue, that's usually a sign of that. Jaw joint discomfort, those type of things. You just want to get checked out, make sure that there's nothing else going on. But a lot of signs, a lot of symptoms. Do not wait until teeth start to break. That's one of the biggest things I would tell you, because usually then that's a result of a lot of other things. And that's usually the result that we see. So therefore we say, oh, we must have a problem now. Nope. Go when you start to feel tightness, snoring, any other types of symptoms that you're recognizing, get to the dentist.
That is amazing. Dr. Acierno, thank you so much for your time today. DecisionOneDental.com is where you go ahead and find more information on any of their 33 locations. Is that what you have right now?
Yep.
33 locations in the Chicagoland area. Thank you so much for your time today. And make sure you go ahead and visit your dentist and make sure you get that corrected, because we don't want any more chipped teeth. And we know there's a lot going on in the world right now, and we want to protect our teeth for a very long time. Thanks a ton.